one of those important vaccination opportunities today as part of World Pharmacy Day. There were, however, a new high of 847 new cases of coronavirus COVID-19 reported yesterday. All cases were locally acquired. This brings us to some 7,611 active cases, and tragically one person has passed away, a man in his 80s from Hume. And we pass on our deepest condolences to that person's family and friends and community. 79% of yesterday's cases were aged 50 or under, and the proportion of cases over 50 as total number also starts to rise, but this is still largely a outbreak of people under 50, the young and the unvaccinated. There are 321 people currently in hospital with COVID-19, and 65 of those 321 are in intensive care and 45 are on a ventilator. 59,342 tests were processed yesterday, and 37,220 vaccines were administered in our state-run hubs. 77.1% of our 16 and over population has now received their first dose, and 46.9% have received a second dose. We are closely watching regional Victoria as the number of cases steadily but slowly rises. The Chief Health Officer will, within the next 24 hours, have more to say about restrictions in both Mitchell Shire and the Greater Geelong area, both of which are due for their current series of public health lockdown measures to be reviewed. However, the Chief Health Officer has advised that given the really good efforts that we've seen in Surf Coast, that they will definitely be coming out of lockdown as at 11:59 p.m. Tomorrow, Sunday the 26th. In regards to Greater Geelong, things are looking relatively positive. There are still a couple of investigations and data being run down with the local public health unit, but there are still some cases there. There were 3 new cases reported from today. 2 are known social contacts and 1 is being investigated. And as I say, Surf Coast, there was just the 1 case, a new case at a business identified through staff surveillance testing at that facility. There was also another new case in the Corangamite Shire. This was linked directly to the Ballarat case from yesterday and has seen a large number of exposure sites across southwestern Victoria. Some 33 have been uploaded onto the department's website yesterday. Whilst mostly Tier 2, nonetheless there are some Tier 1 sites, and I would encourage anyone who'd been to those sites to clearly get tested and follow the appropriate instructions as to how to get tested and isolate and deal with the issues. Additional testing has been set up in that southwestern part of Victoria through our friends at Barwon Health. And there were also 7 new cases in Mitchell Shire, continuing the larger number of cases in that regional shire, and given its immediate proximity to the northern suburbs of Melbourne and the number of incursions crossing that metro regional divide, the prospects of Mitchell Shire continue to grow in numbers is one that we need to forecast. because Mitchell Shire does reflect those patterns of how essential workers, particularly links to construction and other sectors, have seen a quite large number of cases proportionately to the rest of regional Victoria. That gives us an opportunity, obviously, to stress that that if you don't have to move across the regional boundaries, then you should not be. That is what is seeding infections into the regions, largely from Metro Melbourne. But of course, if you are, through a permitted reason or an essential worker, able to do so, you take your restrictions with you as you travel from the region, from the city into the regions. We continue to see, unfortunately, so many of the cases, both in metro and the regional settings, being areas of people, whether it's seeded from a workplace or a particular sector, into social settings. The majority of today's numbers, come from transmissions in homes and families, in social settings. People leaning into the prospect of, it doesn't apply to me, I've always looked after, for very good reasons, my family, I'm going to just have dinner with my family, my parents, my grandparents, I'm looking after my wider family's little kids, all the things that in normal times we take to be our total obligations as community members, but which in these times, with large numbers of social transmissions of COVID virus, spreads the virus. So please, the public health rules are there for the very good reason of seeking to minimise transmission, whilst we at the same time seek to maximise vaccination rates. So please, the rules of not visiting other people's homes in social settings are there to avoid precisely this. And in regards to vaccinations, we continue to see Victorians come forward in really strong numbers, not just at state clinics, but increasingly as a proportion overall of primary health and pharmacies, as their proportion starts to grow. As you'll recall, Victoria, as the state clinics, signed up originally to be about 25-26% of the vaccination program under the Commonwealth's rollout. We've been pushing that at around 50%. It's pleasing now to see primary care and pharmacies grow their contribution as their proportion of vaccines proportionally increases as we head into the back quarter of 2021. But what it also means is that we were pleased yesterday to receive confirmation from Lieutenant General Fruin and the COVID Shield plan that we now had confirmed Pfizer allocations for October. Whilst it wasn't at the higher levels that the Horizon document forecasted, and whilst it wasn't at the higher levels that we are confident that all parts of the Victorian distribution system for vaccines can get into the arms of Victorians, it nonetheless gives us more certainty and more predictability to continue our run to get as many vaccines into as many arms as possible. It means more bookings can be opened and we can make sure that we get those jabs in those arms to get us closer to those COVID normal outcomes and transitions from 70% and 80% double dose of 16 and over out the door as quickly as we possibly can. We're also very focused on bringing the vaccines to the areas that need them most, especially in the north, the west and the southeast of metropolitan Melbourne. And this allows us that equitable distribution of vaccines into the highest risk communities, and the relative certainty that the confirmation from Lieutenant General Fruin gave us allows us to continue to ramp up those targeted hubs and targeted measures of engaging with community to get the vaccines into the arms most at risk. And there are a number of those Vax hubs in both the north and western suburbs, and new community hubs, as we've outlined in recent times, continue now to be able to be rolled out in schools, in pop-ups, and further improving the vaccination opportunities in different communities. Which is a good line for me to now introduce Izzy Huntington. Izzy is an ambassador for the Western Bulldogs Community Foundation, a fantastic group of people associated with the Western Bulldogs in the western suburbs, being all about bringing better health outcomes and better social outcomes in Melbourne's west. And Izzy is here to join us to talk about the newest addition to those community vaccination hubs programs in the west. Izzy has played AFLW for the Western Bulldogs since 2018 and is a former #1 draft pick. In 2020, she won the Bulldogs Best and Fairest, was the AFLW Rising Star and was selected for the All-Australian team. She's currently at Melbourne University and, most importantly of all, is double vaccinated. And I can say Izzy's a constituent of mine, and when she played for South Melbourne districts and I was the goal umpire for St Kilda City, she kept me very busy as I had to wave about 8 flags on the day that Izzy was bombing them from all over the field. So it's a great pleasure to introduce Izzy Huntington.
Thank you, Mr. Foley. I'd firstly like to acknowledge the traditional owners of the land in which we gather today, the Wurundjeri and Bunurong peoples of the Kulin Nation, and pay my respects to their elders past and present. I'm here today as a proud member of the Bulldogs community on a very special day for our fans and for all Victorians, Grand Final Day. Our club is so important to all of the communities in the West, and we know how much this pandemic is affecting our supporters, their friends and their families. As an AFLW player and a Western Bulldogs Community Foundation ambassador, I've had the privilege of being deeply involved in our community programs and have witnessed firsthand the impact this pandemic has had on all of our communities. I know that the only way out of lockdown is for all of us to be vaccinated as soon as we can. That's why I'm already fully vaccinated, and it feels great to be able to contribute in helping Victoria get through this. There are a number of vaccination hubs in the northern and western suburbs of Melbourne, and new community and school pop-ups are further improving vaccine access for these communities. The Western Bulldogs have always been the proud community club of the AFL, and to play our part and help Victoria reach our vaccination target is very important to us. So today I can announce a Western Bulldogs community vaccination pop-up will be set up next weekend, Saturday the 2nd of October and Sunday the 3rd of October at VU Wynnum Oval in Footscray. The Western Bulldogs Football Club and our Community Foundation are delighted to be able to partner with the Department of Health, Western Health, Victoria University and Dr Mukesh Haikarwal in bringing together the immunisers and workforce at this iconic community location. I'd also like to congratulate Kashif Boons and the rest of the team at the club who have managed to get this initiative up and running during such a busy and exciting time for our club. 2,000 Pfizer vaccinations will be available at Wynnum Oval, with 1,000 spots on each day of next weekend. If you're aged between 12 and 59, jump online at the coronavirus website from Monday, the 27th of September, to book your vaccination. Bookings are essential with no walk-ins allowed. I'd also like to thank the Maribyrnong City Council, Hobsons Bay City Council, Wyndham City Council and Brimbank City Council, as well as all of our other community partners for playing their role. I know Bevo and the boys would love to be playing at a packed MCG against Melbourne tonight, and we'd all love to be attending or watching the game with mates. It's not possible tonight for the AFLM Grand Final, but when enough of us are vaccinated, we'll be playing in front of our own supporters, and that keeps all of us at the Bulldogs strong. I'd love to be playing in front of a full house at VU Wynnum Oval come the start of the AFLW season in January 2022. Enjoy the game tonight from the comfort of your couch, and of course, go Dogs.
Thanks, Izzy. And I'll just get Jerome to give us a update on more detail on the outbreak. And we might then just, if there are any questions, go Izzy first because she's got a busy day. Jerome.
Thanks, Minister. Thanks, Izzy. Look, I think a huge thanks to the Bulldogs for setting up the hub for us next week. It's going to be another great opportunity to get more people, particularly in the West, vaccinated. And pop-up sessions like that are proving really popular and effective at the moment. At the Australian Islamic Centre in Newport, we've delivered over 7,000 doses in the space of 3 weeks, with people from 40 different countries of birth on one day alone. At the Broadmeadows Community Hub in Hume, we delivered over 2,000 doses, again over around 10 days, with people from 7 different countries of origin on Thursday. And at the Palm Plaza in Dandenong, we're starting to drive with Moderna next week, and we'll be delivering over 6,000 doses over that coming week. So again, a number of additional opportunities coming up in the days and weeks ahead for people to get their vaccinations, on top of course, the other hubs that we have through our state system. And thanks in particular not only to the Bulldogs, but to all the other community leaders, to the councils, to schools, to so many partners we're working with locally to get these opportunities out there for people to get their vaccination job done. And look, the vaccination programme is continuing to accelerate. Over 4.25 million Victorians have already had their first dose. Over 2.5 million of us are already fully vaccinated, so great to see that progress being made. Over 80% of Victorians aged over 40 have had their first dose, and we're seeing a really rapid demand now from the younger age groups. 60% of those aged between 16 and 30 have had their first dose, and a quarter of those in their 30s, recognising they got their opportunity quite recently, have already completed their vaccination journey, which is just fantastic to see. And even better, the very youngest Victorians, 12 to 15-year-olds, 29% of them have already had their first dose. They are really just accelerating up the leaderboard and just getting out there and getting it done. And we're continuing to see that enthusiasm for vaccination right across our network. What's also really pleasing to see, and as the Minister said, we've started to really skew our vaccination allocations, particularly to those LGAs and communities where we have lower levels of dosing. Wyndham now has over 80% first dose vaccination. In fact, it's well ahead of the Victorian average. Hobson's Bay is at 76%, and Casey is at 75%. So 3 of our most priority LGAs already hitting really good first dose penetrations. We've also seen a really steep rise in vaccination rates in Hume. That's increased by 15% in the last since the 13th of September. So it's gone up by 15 percentage points. Wyndham's gone up by just under 13%. Casey's gone up by just under 13%, and Greater Dandenong by 12%. So a real step up with that additional vaccine supply going in, and fantastic uptake across those LGAs. I'm also pleased to confirm that we have had our forward allocation for vaccine from the Commonwealth, and my thanks to our partners in the Commonwealth for ensuring that we've got confirmation of supply over the month of October. So I think we said a couple of days ago, the state will receive 204,000 doses of Pfizer for the week of the 4th of October. That will step up to 234,000 doses for the following week, and then 265,000 doses for the last 2 weeks of October in each of those 2 weeks. What's even more significant is that we're seeing a real acceleration of the number of Pfizer doses going into GPs. So GPs from the 4th of October in Victoria will receive 400,000 doses a week of Pfizer for those first 2 weeks of October, stepping up to 427,000 doses a week for the last 2 weeks of October. And the new entrants to the game, our pharmacists, will be getting 150,000 doses of Moderna from the 4th of October, and then 200,000 doses a week of Moderna for the rest of October. What that shows, of course, is that there will be significant additional opportunities to get your vaccine, not only in the state clinics, and we'll continue to run those, and our pop-ups, but there'll be over 600,000 doses a week available from GPs and pharmacists. So please, don't only use the state clinics. If you can't get your appointment in the state clinics, go to your GPs, go to the pharmacists. And a big shout out to the pharmacists. It's been great to see those street signs coming up left, right and centre indicating they've got vaccine availability. So please do use that opportunity to get yourself done by your local pharmacist. In terms of case numbers, again, I'm afraid it is a very consistent picture of the last few weeks, where we're seeing continual high levels of household transmission, particularly across our northern suburbs. We now have 522 cases in our northern suburbs in the last 24 hours. Again, over 60% of those cases in the northern suburbs. Of those, 339 are in the borough of Hume. So again, a very high concentration, and the majority of those cases are just in 5 postcodes. The key suburbs of concern continue to be Roxburgh Park, Craigieburn and Broadmeadows. And we now have just under 5,000 cases in the northern suburbs, just under 2/3 of the total cases in all of Victoria. In our western suburbs, we had 183 reported cases. It's just over 20% in the last 24 hours across locations such as St Albans and Tarneet and Werribee. In the southeast, we have 89 new cases today, particularly in Cranbourne East and in Dandenong. And in the eastern suburbs, we have 21 new cases in Doncaster and Doncaster East. We also have one interstate case and one case we're still tracking down. There are also 30 cases across regional Victoria, and around 10 of those, so a third of those cases, are workplace incursions from people living in regional Victoria working in Metro Melbourne. And again, the theme of the last week or two has been how important it is that those of us who are working in Metro Melbourne, if you're living in regional Victoria and you are a permitted worker, you have to be exceptionally careful around your symptoms and around all your COVID-safe protocols, given the high level of infectivity we're seeing in some parts of Metro Melbourne. A couple of cases to call out. We have 5 of those cases in Barwon, in the Barwon area, 2 in the Lara area, and one of the cases in Lara is an employee at the Viva refinery. We have around 80 or so primary close contacts. Around 60 of them have returned a negative test result so far, but we're continuing to work with the refinery. Obviously a critical asset for us. No other positive cases at that location yet, but that'll be a focus for us over the weekend. We also have an individual who tested positive on the Surf Coast through our regular surveillance testing program, particularly in the meatworks industry. I'm pleased to confirm that that person has since returned a negative follow-up test, so they're likely to be removed from our numbers tomorrow. We have an additional case in Wodonga, in addition to the existing 4 cases we have in that area, which is a truck driver and a number of household contacts. We also have a number of additional cases in the Bendigo area. We talked yesterday about a contractor working on the track upgrade between Epsom and Echuca. We now have 3 more workers on that work site who've all tested positive, and they live in different parts of regional Victoria, but that relates to the exposure sites we've seen in Bendigo released in the last 24 hours. Finally, we have 3 more cases in Shepparton. 2 of those relate to a previous case of household primary close contacts. We are continuing to inquire after the 3rd case. It looks like it might be a traveller who's coming up from Melbourne who's taken the virus back into the Shep area. And of course, we're very keen to ensure that the amazing response we saw in Shep in August is not all undone by further incursions into that area. We'll put a full list of all those LG exposures in our show release as we normally do this afternoon. Testing numbers continue to be very strong. On average, we're now doing 57,000 tests a day since the start of this outbreak, well over 2 million, 2.3 million tests undertaken since the start of August. We've expanded capacity at the Melbourne Showground site, Pleventon Showgrounds. That's now a 12-lane super site. We've upgraded the Casey Fields testing site up to 4 lanes. That's double the capacity there. And we've increased capacity at Monash Clayton. There is also more testing capacity at Coolaroo and Burwood. So we continue to put more capacity for testing out there for those who need it, but I can confirm, of course, that we're seeing strong testing demand, of course, over the last few weeks. But again, short queues in the afternoon, plenty of capacity out there across our network for people to get their testing done. Good return, good results. Again, I'll put these in the show release around testing demand in our regional locations, particularly in Wangaratta and at Kyneton. And my thanks to everybody who's been coming out to get tested over the last few days. Finally, one of the concerns we have around these rising case numbers, of course, is the impact on our healthcare system. The Minister's mentioned today we have 321 people, Victorians, currently in hospital. That's a 55% increase on a week ago. It's a 124% increase on 2 weeks ago. So as we see case numbers rise, inexorably we also see hospitalisations rise behind it. And this is why it is so critical for all of us to do everything we can to minimise that household-to-household transmission and to minimise the community transmission we're continuing to see in key parts of Melbourne. I'd urge all Melbourneians at this time, the finish line to 70%, 80% double vaccination is now not that far away. How we conduct ourselves over the coming weeks, how we conduct ourselves tonight, is going to be critical to where our case numbers go, but more importantly, where our hospitalisation numbers go over the weeks and months ahead. We are doing everything we can to create that capacity, but creating capacity in a healthcare system, in a hospital system, means denying others the chance to get treatment and the opportunity to get their own important treatment. So please, minimise that transmission, minimise that household contact now. Do it for yourself, do it for your family, do it for those you love, and do it for the people you do not want to end up in hospital over the weeks ahead as we all stretch the line, as we do everything we can to get vaccinated and get to the finishing line. With that, I'll hand over for any questions, probably for Izzy first of all.
Happy to go with Izzy first.
She was good. Got everything I needed.
Awesome. Thank you, Izzy. All right. Do you want anything from me?
Yeah, can I just, quick one, Jeremy?
Yeah, sure, Blake. Thanks, Izzy.
Acceleration of Pfizer doses into GPs. Can you give us the numbers again? 400 to...
I can indeed, and welcome back, Blake. So we have around. So last week there was about 165,000 doses allocated to Victorian GPs. From the 4th of October, the Victorian GPs will be allocated by the Commonwealth 400,000 doses a week. On the 11th of October, another 400,000. That goes up to 427,000 for the week of the 18th, and then another 427,000 for that last week. As importantly, bear in mind, last week the pharmacists just started, so Moderna has just started to come into our state. The pharmacists will step up to 165,000 doses of Moderna from the week of the 4th of October, and then they go up to 200,000 doses a week. And my point is that suddenly we have essentially 600,000 doses of mRNA vaccine available through GPs and pharmacists in Victoria, compared to around 265,000 doses going to the state. That's a very welcome thing. It means lots of points of contact, and it means that all of us, whether we need to get our first dose or complete our second doses, have many more options to choose from. And I'd really urge people now, let's get this done over the next few weeks.
What happens if GPs and pharmacists don't use those allocations within the time period? Can they be reallocated? Is there a special system where they can go back into the state hubs? What's the system?
Yeah, there is. We've agreed with the Commonwealth, and we agreed just a number of months ago that any vaccines that are not taken up by the GPs or by the pharmacists will be recycled into the state clinics. So from time to time we receive a bit of any surplus that's left behind that gets essentially fed back into the state system. And look, we know we've seen a really strong demand at the state clinics. We continue to see really strong demand. As we stand here today, we had 28,000 bookings made yesterday for state clinic appointments. I've got 10,000 first dose appointments left across AstraZeneca and Pfizer for the next 7 days. But there are many more appointments now, or opportunities now, within the pharmacists and the GPs. So if you can't go to one of our state clinics, then please go to the GPs and pharmacists and do not delay getting your vaccine done.
And with the GPs and pharmacists,
Yep.
Are they sticking to the same schedule for doses weeks apart, or can they decide what period there is between those doses?
Yeah.
So could they decide 30 days, 4 weeks, 3
Sure.
weeks?
Sure. So look, we're all governed, of course, by TGA advice, by ATAGI advice, and they provide a clinical framework around dosing and dose allocations. Moderna is on a 4-week cycle, so the pharmacists will be operating purely with Moderna and providing a 4-week interval around those doses. My understanding is that the GPs are in that 3 to 6 week interval for Pfizer, so there'll be only Pfizer available from GPs, as well as AZ, of course. Some of the GPs, I think, are now operating on starting to offer a 3-week interval. That's great, and if they've got the capacity to do that, that is a good thing to do because it brings those second doses forward. Obviously, we're still relatively constrained in the state system, so we're continuing to focus really hard on getting those first doses out there over the coming weeks.
Can I ask the Minister just about the change yesterday, the advice from General Fruin and what's now looking like the doses that will be available? Does that mean you can start looking at altering that schedule, or when will that decision be made?
So, starting from the basis of why that's the case, we shifted some months ago to 6 weeks, from 3 weeks to 6 weeks for Pfizer, on the basis that it was really critical to get that first ring of protection into as many Victorians as we possibly could for the available stock that we had. And as you recall, we saw a decline in stock into Victoria in September, and that further made that 6-week interval even more important. With the high numbers of cases in the north and the west and the growing numbers in the southeast, that's still our strategy. That's our first ring of protection, is to get that vaccine into as many arms as we possibly can. The confirmation of the figures that we got from the COVID Shield commander yesterday allows us with certainty to now continue over the course of October for that first really high blitz of getting as many vaccines first dose into many people as we possibly can. What it doesn't give us, in terms of the horizons pitch that the Commonwealth said you'll get between this amount and that amount, it's not at the higher amount. So at this time, the projections that we're working through don't give us the ability to bring that dose in state-run clinics from 6 weeks down. We'll continue to work with the Commonwealth, and we'll continue to prioritise first doses, and as soon as we can bring that date down, we will. But based on the numbers, as welcome as they were, that we got last night, we're not at that position yet.
Do you know when you might be?
We just got to work through, as Jerome's indicated, we know what we're getting each of those weeks. We're hopeful that in terms of the projections that we want to land, particularly in the north, particularly in the west and particularly in the southeast, that come sometime in October, we'll be in that position to bring that forward. And hopefully the earlier the better.
And if that was to happen, would people who have already booked in their doses 6 weeks apart be able to readjust that and ring up and say, can we move
That's
forward?
the goal.
Yeah.
So the first goal from this time yesterday was to make sure that we didn't have to cancel first bookings and that we didn't have to cancel vaccine pop-ups, which were at real risk of being the case. We've locked all of those in, and that's welcomed. And then the next stage is reviewing exactly how many we've got of those critical first vaccines into people's arms, and then bringing forward on the available doses the rest of those time frames to bring forward that race to 70 and 80 for double dose.
Singapore has got 80% double vaccination, and they've just introduced more restrictions after easing them. Our roadmap's about a week old. How much is that a set and forget roadmap, or will you rely on new modelling, and how regularly do you expect to get that?
I think Singapore's pushing 90% and have just reintroduced some severe measures on the basis that they've had quite a uptick in cases. South Korea, the same. A lot of comparable countries are facing similar challenges. It has never been set and forget. When we released the roadmap and the Doherty Institute and the Burnett Institute modelling last week, it was always on the basis of we would continue to review where cases were at. Today's case number is a record high, and I suspect in the coming days and weeks it will continue to grow, because the modelling we released last week from the Burnett Institute pointed to cases continuing to increase until around mid to late October, and then peaking, and then as the next stages of the roadmap are introduced, people start moving as things open up, the potential for further increases. That is why getting the first doses of protections into as many people's arms as possible is critical to keeping both of those peaks down. The guide rail, for want of a better phrase, that we've always had in place is this comes at the expense of people in hospital, and we have to make sure that the support for our already exhausted and fatigued paramedics, ED workers, hospital workers, ICU workers, clinicians, is that they are supported in getting us through this until the vaccine curves the numbers. It's a real challenge. It'll be a challenge in New South Wales as they open up, presumably first. It'll be a challenge in Victoria, and it's a challenge right around the world.
I guess one of the parts of that was that we'd hopefully get 30 people in our home by Christmas, when it was about to be at maybe 80, 90%. You know, is there a suggestion perhaps that we shouldn't rush too soon to book or plan those things, given what we're seeing overseas? The
roadmap is the goal, where we want to be, and as we indicated on last Sunday when the map was released, and the data projections that the Burnett Institute had put out there, we can see when those peaks are likely to be. The goal is to keep those peaks down to the very minimum we possibly can through the strongest possible provisions of vaccines and the sensible social measures that are needed to keep for control measures that allow us to keep that peak down. It's not a question of there not being a peak, it's a peak that is coming, and it's a peak that needs to be managed through vaccines and other measures to be as low as possible to protect our healthcare system and the lives of Victorians.
So the allocation confirmed for October, give you confidence that we'll hit those other benchmarks, those milestones, 70% double dose, 80% double dose, or have those dates shifted at all, given that we've missed this first milestone just a week after?
So the 80% single dose figure will be early this coming week, a matter of days away. And the sooner people get down to those vaccination clinics, get to their pharmacist or get to their GP, the sooner that will happen. And now that we have a degree more certainty, not to the level we want in terms of supply, but supply enough to confirm what we have in the system, we continue to be confident that we will meet those 70 and 80% double dose figures in the indicative dates that we've indicated.
So can you explain why we missed this first target? Is it simply a demand in the public?
It's a combination of factors. Whilst we've seen the rise in vaccination levels every day, and we've had our biggest turnout of the vaccine program each of the last few weeks. It continues to grow, and that's a fantastic reflection of the appetite of Victorians to want to come forward and get vaccinated and get us through this. With projections such as yesterday's public holiday and today's grand final day, we've seen that in terms of the modelling slip a bit, but we hope that on the back of now the certainty around hubs, the certainty around GPs, that we can bring the rate of growth forward, and we have every confidence that that will happen.
But like you mentioned, the vaccination rates have been steadily increasing, and we sort of knew we were going to miss this yesterday. So what were you projecting we were going to do per day if we've been hitting records but we're still not making this 80% benchmark tomorrow? So
what we have is across the Commonwealth, across all states, unlike how vaccination programs had been done for the last 70 years, where the Commonwealth procures the vaccine and then provides it to the states, who through a whole range of methods get it out in a seamless integrated system. For reasons that the Commonwealth Government made clear when the program started in February, March, they've run a 3-track system. Provide a certain amount to state clinics through one distribution channel, a certain amount to primary care and GPs, and now a third channel of provision to pharmacists. In all the states' estimations, whilst we welcome the enormous effort that's gone into that, it's not the most efficient system. And what we've seen is, particularly in allocating resources as to where the most effective method of distribution is, it could be better. Having said that, since the COVID Shield program kicked in under Lieutenant General Fruin, it's ratcheted up to a whole new gear, and we are determined, as indeed are all the other states, to make sure it works.
Do you mind if I ask Jerome just a question about the proportionality of these household transmissions, Jerome, that you and the Minister have mentioned, of today's 800 odd cases? Do you know how many are essentially due to these illegal visits?
Look, let me simplify it this way. So over half, around 55% of the numbers yesterday and the numbers pretty much over the last week have been cases within the home. So this is where there's a positive case in a household and others within a household are getting infectious. So there's nothing illegal happening there. The vast majority of the other 45% are coming through social interactions between households. And that is, again, a very consistent pattern we've seen really for the last 5 or 6 weeks. Ever since the numbers started to take off, we've seen a growing number of cases of household-to-household transmission, which when our contact tracers speak to individuals, we can start to build a very clear picture. And it's the things that the Minister's alluded to. It's it's helping out your mum by by doing some small chores. It's around going and seeing your cousin. It's all those day-to-day things we all desperately want to go back and do. And we are seeing far too high a level of that still happening, not just within the northern suburbs, but across Melbourne. What's happening in the northern suburbs is because we have such a high level of community transmission, the virus is taking a ride when those everyday kind of interactions are taking place, and that's why the restrictions are there to prevent that kind of behaviour from happening as much as possible. And that's a real, absolutely get it, it's an absolute dilemma for every single individual in every household. But that's proportionality. What we're not seeing in these numbers, Mark, is we're not seeing big workplace outbreaks. So, you know, of the workplace outbreaks in the last 24 hours or so, we've got a small rail project site up near Echuca, Bendigo Echuca, which is 2 or 3 cases in today's numbers. You know, we have 10 people in regional Victoria who are taking the virus home from their workplace. So relatively small numbers, all important, because this will be a real challenge, particularly in our regional settings. What we can't have is one, the exposure at workplaces taking into regional Victoria. If we then see household transmission in regional Victoria, then numbers will start to look very much like what we're seeing in the southeastern suburbs of Melbourne at the moment.
The reason I ask is because obviously it's the grand final tonight,
yep.
And if people are doing that, essentially when there's been very little motivation to get together anyway, but tonight is a pretty big motivator. Right. I mean, what are you bracing for, or how are you feeling heading into that?
Oh, look, I mean, I think every day you look at these numbers and you see the increases we're seeing, and you look at the attribution of that, and it's largely those everyday small behaviours that we all think are kind of okay, but they're not because the virus is taking a ride. I'm extremely worried about tonight. I'm extremely worried that, you know, large numbers of Victorians will say tonight, well, you know, for tonight we'll all get together and have a good night out, and we'll take our masks off and we'll scream and we'll shout and we'll have a good drink. And as a result of that, in 6-7 days down the road, we've got another big cluster of cases and another big step up in our infection numbers. And we're just so close. We are now so close to, 77% of us having had our first dose vaccine. We know that in the next 5 or 6 weeks, we can get to those 80% double dose vaccination thresholds. But if we let it all go now, and if we continue to see these numbers, you know, increase as much as they are, we will have hundreds of people in hospital in the next few weeks. And they'll be there well beyond the 80% double vaccination rate. You know, just when you get to the 80% double vaccination, if you're already ill, that's not helping you.
Joan, I wanted to ask about contact tracing. We've spoken to some contact tracers that say, given the sheer number of sites now and the resources, that they described it as a ramping down, but more a focus on, I guess, higher tier sites. How do you see the resources going into contact tracing in the coming weeks, given the amount of sites and where they need to, I guess, focus, whether that be tier 1, 2 or 3?
So look, we've got hundreds of contact tracers working all across the state on every single set of positive cases and outbreaks. We absolutely, and if I look at start with the regional cases first of all, the approaches we've always taken around primary and secondary close contact, rings of rings, multiple exposure sites, that work continues on. And our regional contact tracing teams are doing a fantastic job staying on top of those small numbers and making sure those numbers don't go any further. Within those large exposure areas, if I look at the north and the west in particular, we've brought in hundreds of additional resources to make sure that our contact tracers can keep up on those increasing number of cases, not only at the first contact, but also supporting them through their infectious period and making sure they can continue to isolate safely. But absolutely, we are increasingly focusing on shorter interviews, getting to the heart of the matter more quickly, focusing on those high-risk primary close contacts, focusing on those high-risk exposure sites. So you are seeing a lower rate of exposure sites being nominated for 2 reasons. One is people, we are still in lockdown and we're not seeing people who've been active at school sites or at work sites or at retail sites in the same proportions that we would have seen 6 weeks ago. But also because we are now focusing on what are the highest risk settings, where are the people we absolutely need to get hold of to make sure we isolate and support. So we'll absolutely continue to, through our triaging system, focus on those people who are most at risk, most vulnerable, and who need that additional support.
Are the number of cases tracking as you thought they would based on your modelling, or are they going up higher? Because the rate of increase has obviously been fairly significant in the last week or so. Yeah,
look, we were standing here a week ago, 6 days ago, and it was we had a period of relative calm for about 6 or 7 days, bouncing around that 500 number, and the numbers felt fairly consistent. If you look at the Burnett modelling, there was a number of different range of scenarios for case numbers and for hospitalisation numbers. We're continuing to update that modelling. We'll probably release another set, I suspect, at some point next week to get a sense of what trajectory we're on from the roadmap that we released a week or so ago. But look, it's in the range at the moment. We've seen 2 big days in succession. I think, as the Minister says, I expect to see bigger days in the days and weeks ahead. But this is in all of our hands. This is not now like somebody else's problem anymore. We've got 7,500 or so people that are now active cases. It is about their behaviours, but it's about the behaviours of all of us, around how much more contact we're going to have with each other. That's all will determine where these numbers go.
Do you blame that increase in household transmission, not the ones where people aren't breaking the rules, but visiting relatives and friends? for why our outbreak has grown so much more quickly than what we've seen in New South Wales?
Yeah, look, I think, again, you can look at the rates of increase between New South Wales and Vic, and there's different starting points and different datum lines you can look at. What I think we did well in Victoria is between the middle of July, when we first hit the 50 active cases in the community. It goes all the way back to, I think, to the 15th of July, when we first hit that threshold. That's a threshold that New South Wales, I think, hit about a month earlier. We did really well through July and August to hold it down for a long period of time, and then we saw those numbers really rise steeply at the end of August and the beginning of September, and that's been a real challenge for us. So the last few days, again, we've seen that really rapid rise in cases. It is down to ultimately how much discipline we've got collectively. If people, particularly in communities where we're seeing high levels of COVID circulating, are going to continue to visit each other at home, they're going to continue to do all those day-to-day things that are clearly very important to people, but that are so dangerous when you have a high level of virus circulating in your community, then these numbers will continue to rise at the rate that we're seeing. If we hold ourselves back for 5 or 6 weeks and say, let's just get those vaccination thresholds through, let's keep this fuel load down as much as we possibly can, because that will allow us, as the Burnett modelling showed the other week, that'll allow us to actually get through to the back end of the year with a far lower level of cases, but more importantly, lower levels of hospitalisation, fewer people sick, and fewer people ultimately ending up in ICU and worse.
And apologies if I missed this. Did you run through the vaccination numbers for the people in hospital or even this individual who's passed away?
I didn't, and I don't have those with me today, but we'll do those tomorrow.
Do you have any more detail about the man who died, the man in his 80s?
No, I don't, I'm afraid, no.
Maybe a question for Martin. We've seen a 55% increase in hospitalisations in the past week, 124% over the past couple of weeks. If it continues with that sort of trajectory, at what point does it start to look really bad in the hospital system?
Well, it's looking challenging every day. Our public health system was already dealing with peak loads before this particular outbreak as a result of deferred care, as a result of increased levels of demand more broadly. So the measures that we've put in place and that we will continue to put in place will mean that we have to prioritise care for COVID patients across, whether they be in the community settings, understanding that most positive cases will continue to not actually require hospitalisation, but will need care and support in the community. And then through that COVID positive pathways plan, the number of people in hospital is the key figure. We remain on schedule to start, because we can know what's coming, to revamp both our public and our private health system to manage that coming peak, and we know that we can do that, but it will be at the expense of other arrangements in the health system, and it will be at the expense of our already fatigued healthcare professionals working even harder. And if for no other reason, the reason to go and get vaccinated, the reason to follow the social rules around what you can and can't do, it's not just to protect yourself, it's to protect our health system and the healthcare workers in that health system who will be working around the clock to get Victorians who are unwell through that.
When do you expect that to happen? You said you can see what's coming. When do you expect to be reallocated? I'm assuming elective surgeries and things being cancelled.
So it's already been ticked along step by step. We had the first phase being the hospital streaming processes, where we nominated a number of hospitals. We're bringing as specialist centres for either general patients or specialist groups, pregnant women, the elderly and others. Those plans are, as we speak, being ramped up. We're in discussions with other parts of the healthcare system right now about what areas will continue and what areas will need to pause whilst we put as many resources as are needed into the healthcare of COVID patients.
What do you think you'll need to pause, to cut back on to cope with this caseload of COVID
as New
patients?
South Wales have done, as we did in 2020, and as indeed some other states with very low or no cases are doing at the moment. Elective surgery is, particularly non-urgent elective surgery, is is clearly on the table to pause and to delay, as is equally partnering with the private sector so as to make sure that other urgent work that would be done in the public sector can be done in the private sector, thereby freeing up further capacity in the public sector to look after COVID patients.
And at what point do you think we'll get to that, having to pause?
I suspect, as the Burnett modelling predicted, over the course of October.
Last question.
Just in terms of another high-risk area, prisons, is it a mandated vaccine for all prisoners in Victoria?
So there is, I'm pretty sure it's not mandated, but it's widely supported in the justice system. We've had a program for some time now through the Department of Justice to deliver to both the workforce in the justice system and the prisoners in the justice system the support they need for vaccinations. That continues to grow. I don't have the actual figures, but I don't think it's mandated as yet. But what we've seen in the justice system is a really high level of uptake.
Minister, I know you're not the Minister for Police, but it looks like the protests are being handled quite well by police today. Large number of them out and about, arresting small little spot fires, but they haven't been able to gather en masse. Do you feel like they've finally lost a bit of steam?
I hope so. What we've seen over the past week with the efforts in Richmond and Hawthorn last weekend and the completely regrettable activities over the course of this week is unrepresentative, ill-advised activity that will only achieve the direct opposite of what it says it is designed to do. Protesting does not work against this vaccine, against this virus. Protesting does not work in terms of looking after yourself for protecting from this virus. We've already seen a case turn positive from those protests, and we will presumably might well see more. We've seen Victoria Police members have to be isolated as close contacts, and what we need to see is those ill-advised protests to cease. Victoria Police are clearly on top of it. The best thing that those protesters can do is to go home and organise to get vaccinated.
Sorry, did you just indicate that there'd been transmission at the protest, or just somebody that was infected had been at the...
We had a positive case that was reported yesterday.
I acknowledge that, but did you say...
If I did, it was a slip of the tongue. At the moment, the only known case that I'm aware of is that person, but given what we've seen for Victoria Police, who were associated with that case, now having to be isolated, the risk continues to be real.
And has there been an infection or anything to do with the Spirit of Tasmania?
So I can answer that one to the degree I can. So we know that there was a positive case in the engineering crew of the Spirit of Tasmania, and that has seen a public health response in both, as I understand it, Port Melbourne and Devonport have to be established to very quickly test and respond both to the other crew members and the passengers.
Do you have any idea how many crew members there were or how many passengers there were that may be affected?
It only came in this morning, but I'm sure we can update you.
Was that a crew member from Melbourne or Tasmania?
I think Melbourne.
And sorry, just on the restrictions, so Surf Coast definitely coming out tomorrow night, but the other regions that were supposed to are highly unlikely now, Geelong...
Mitchell Shire is unlikely, but the public health team are going through that, given its proximity to the northern suburbs and the very high numbers of cases proportionally to the rest of regional Victoria that continue to be seen. As Jerome indicated, subject to some more negative tests coming in from a particularly large and important exposure site, the Barwon and public health team are a bit more confident about Geelong. The people of Greater Geelong and Barwon Health and others have done an extraordinary job, but it's pretty much anywhere that's in close proximity and has a lot of crossover between high-risk areas of metropolitan Melbourne and those regions continue to be at risk. And what we want to make sure is that we've just hammered down all the last few items before the public health team make a determination.
Just on Community Sport, Minister, if I can, for a question for a colleague. When is that due to resume, and is that one of the lower risk kind of events that we can see back on the calendar?
So the roadmap did address this. It talked about in some of the non-contact areas starting as soon as we hit 70% single dose, and then training and other supports at 70 double, and then coming back on gradually to competition post 80.
Are they lower, some of the kids' sports specifically, they'd be lower risk?
These things are all determined on a risk basis by the public health team. Understanding that the roadmap is not public health orders, it's a roadmap. And as we get closer to each of those dates, more of the detail, more of the engagement with stakeholders, more of the opportunities to balance the needed and necessary reopening with the public health measures will emerge. All good?
Thank you.
Thanks, everyone.